Namaste. In this presentation, I will talk about observational study designs as part of the Health Research Training Workshop organized by the Research and Scholarly Activity Committee at PAHS. I am Dr. Amit Arjyal, an Associate Professor at PAHS. I will focus my talk on introducing observational studies, the key types of observational studies, their strengths and weaknesses. I'll give a few examples and a few points to consider and wind up with the conclusion. Observational epidemiology concerns the use of epidemiological reasoning, knowledge, and methods in studies that are non-experimental. Epidemiological studies and programs, for example, surveillance, in which the main conditions, for example, exposures, are not under the direct control of the researcher, are observational studies. Classic example of such studies is the studies linking smoking to lung cancer. Researchers cannot make participants smoke. They cannot make smokers quit, so they have no control over the exposure. All they can do is observe if certain participants go on to develop lung cancer or not. Non-experimental studies do not involve any intervention, experimental or otherwise, on the part of the investigator. Let's illustrate this point with a study that wants to see the effect of surgery versus conservative management of acute appendicitis. In a given hospital ward, surgeons choose to operate or carry out conservative management. Both may be part of the protocol in that center. An observation study or a researcher conducting an observation study would just observe what happens after each treatment modality. He would not ask the surgeons to either operate or carry out conservative management. They would do so as they sought fit. Therefore, in clinical studies, we need to separate the investigator or researcher from the treating physician or surgeon. The importance of observational studies. Many observational studies help to identify risk factors. They also help to generate hypotheses which may be tested by other studies. Key types of observational studies that I will consider in my talk are cross-sectional, case control, and cohort studies. Although case series, case reports, and ecologic studies are also observational studies, I will not discuss them in this talk. To begin with cross-section studies. These capture exposure and outcome both at the same time, also called a snapshot. For an example is the Nepal demographic and health surveys, which are carried out every 5 years in Nepal. And similar health surveys are carried out in many countries across the world. They are useful for measuring prevalence. But such studies cannot assign cause to an outcome. Have a look at this table, which shows, based on data derived from the Mobile Demographic and Health Survey of 2021, association between 4 or more ANC visits and mass media exposure, internet use, and health program exposure. Now, all of these variables, these characteristics, ANC visit characteristics, whether a woman delivered at an institution or whether ANC checkup for mother and newborn was carried out, was asked during the survey interview. Survey also asked about place of residence, ecological belt, religion, age, wealth, education, husband education, occupation, health insurance coverage, and distance to health facility. This table shows the association between these characteristics with the health service utilization characteristics. The adjustment here, also shown by this adjusted odds ratio here, signifies that these variables were similar across the groups with no media exposure versus media exposure, the groups with no internet use versus internet use, and the group with no health program exposure versus those with health, from which we derive the adjusted. Let's move on to case control studies. Case control studies compare cases with controls. Here, it is important to distinguish what a case is and what a control is. Cases are those with a condition, and controls are those without. Therefore, a case has to be clearly defined. A key measure in a case control study is the odds ratio. It is useful for rare outcomes and diseases. But biases can occur when exposure is recalled among both cases and controls. Bias can also occur when selecting controls. In a case control study, the outcome generally is known and has already occurred, from which we select a sample of cases from the population. Those without that outcome are the controls. And we go back in time to determine whether the cases were exposed or not, and whether the controls were exposed or not in the past, or present. We do not ask at the same time everyone in a sample set. We only ask these with cases and selected controls. Case control design is chosen when the incidence rate of the outcome is low, when the lag time between exposure and outcome is long. We cannot wait for a long time for exposure to occur. When the incidence is low, if we wait and see whether the incidence will occur or not, it may never occur, making it impossible to study. Let's look at the same example. Say home delivery rates were very low in a particular setting. For example, in the cities of Nepal or in settings around Kathmandu Valley, present. So if we want to know what is the factor that led to those who delivered at home in the present context, we could select those mothers who delivered at home and compare them to those who delivered at health facilities and ask them if the use of ask them if the use of internet was an exposure that led to delivery at health facility. We can also ask them if they themselves, having been delivered at home, led to them delivering at home. So if we begin from the outcome, define the case as we have done here, someone who is delivered at home, and go back and ask, were you delivered at home when you were born? Then that will be a case control study. We can also ask them a host of other things which we might think have led to them delivering at home. Case control studies, we calculate odds ratios, which is simply the ratio of the odds, which in turn is the ratio of event to not event. Here we have defined event as delivery at home. Let's move on to cohort studies. Cohort study, we follow a group for a certain length of time, months, years, decades. They are useful for measuring incidence and comparing incidence. The key measure is relative risk. They're useful for rare exposures. For example, if in a population, very few women have been delivered at home themselves as a child when they were born, and we want to see if they in turn deliver their child at home, we can use the same variables for a cohort study. This ensures temporality, that is, the exposure precedes the outcome. And we can also test multiple outcomes from a single exposure. As I mentioned before, linking smoking to lung cancer is one type of outcome, but we can also link smoking to other respiratory illnesses. We can link smoking to heart disease. We can link smoking to cancer of the bladder and so forth. But cohort studies, since they take a long time to occur, we have to keep on following the participants, need resources, both in terms of time and money. The word cohort is derived from Roman times, when the Roman army, their troop, was called a cohort, and the only way the troop knows how to move is marching forward. So hence, study which goes forward in time. So, for a cohort study to occur, you need to start with the exposure and then go forward in time to reach the outcome, as shown in this figure. There is also something called a retrospective cohort, where although the outcome has already occurred, we do not consider it when we start the study. We go back, look at the records of the participants concerned, look at their exposure, and then track the record to see if outcome occurs in those who are exposed versus those who are not. Sometimes we can do both. But whatever we do, we always begin with the exposure and end with the outcome, regardless of the fact that the outcome may have occurred as shown in these two arrows, or it has already occurred. Table for a cohort study would look like this. Since we know the total number of patients or participants who we follow, we can compute the risk, which is the incidence of particular event occurring. We may choose to follow if delivery at home is quite a common event, whereas those who use or never use the internet is quite rare. We can have those as exposures and follow them up throughout their pregnancy and see if they deliver at home or not, which is our outcome of interest. Since we have the total here for both these rows, we can know the incidence or risk in those who use the internet of delivering at home versus those who don't use the internet and deliver at home. The ratio of these two risks is called the risk ratio. What are the strengths and weaknesses of observational studies? They observe the real world, in contrast to experimental studies which may not apply to the real. Going back to our example of appendicitis, if surgery was the norm and researchers decided to compare non-surgical treatment of appendicitis in their study and came up with the conclusion that non-surgical treatment was better, it would not be applicable to the real world because practitioners may hardly be practicing that. But these studies are cheaper. Also, these studies are cheaper compared to experimental studies. Experiment, you have to bear the cost of treatment yourself because you are undertaking a protocol which is not the norm. The weaknesses of such studies are confounding. For example, studies comparing years of life lived. Longevity differs between males and females. So if we don't adjust for gender, if one group has more females, that group would tend to live longer, predisposed by their gender. Similarly, if we compare cancer death rates, if we don't control For age, of course, the group with the younger patients will live longer than those with the older patients. An 80-year-old with the same cancer would be expected to live longer, live shorter than a 60-year-old with the same cancer. These studies show association, but it is difficult to infer causation. There are also a few biases. For example, in a case-controlled study, exposures may be forgotten. If a breast cancer patient would be asked if they ever consumed OCP, they may recall consuming years ago, whereas a healthy person might not recall. Similarly, selection biases may occur depending on how we choose cases or those in a cohort. A few examples of observational studies are the Framingham Heart Study, the British, which followed people in a town called Framingham in the state of Massachusetts in the US for many years and associated the risk factors for heart disease with the eventual onset of heart disease. The British doctor study followed British doctors for up to 50 years and saw the association between death from lung cancer and smoking. Other observational studies are studies carried out among nurses, and more recently, observations have been carried out on hundreds of thousands of people through large cohorts such as the UK Biobank and Kaduri cohort, which collect information about dozens of risk factors and then follow them up over years to see outcomes such as the development of heart disease or cancers or even death. There are important considerations while studying or designing observational studies. We need to know what a case is and what a control is. We need to define the cases well. We need to understand what exposed versus unexposed is. Sometimes what a case is in one study might be the exposure in another study. Say we want to know what the risk factor of tobacco smoking is. In such a study, tobacco smoking is the case. Whereas if you want to know what is the effect of tobacco smoking in a certain condition, such as heart disease, then tobacco smoking would be the exposure. We need to also understand that the use of the word control also appears in experimental studies. When we are not undertaking an intervention, that group is called control. The exposed and unexposed may also be replaced by treatment A versus treatment B, as in the example of acute appendicitis being treated surgically versus non-surgically that I provided earlier. There are terms such as confounding and interaction. For example, the outcomes of a study may be confounded by the gender or by the age. So we have to adjust for those variables. In an example I showed earlier, there were so many variables such as geographic location, religion, and a host of others which were adjusted for to prevent confounding. Sometimes two variables might have an additive effect on the outcome. For example, when studying the relationship of smoking and an outcome such as cancer, there may be other variables such as industrial exposure to other carcinogens, which may add up to smoking and lead to cancer, which is called the interaction. There are other biases as well. In summary, observational studies simply document what is happening, what happened in the past, or what happens in the future. Although looked upon as a weaker form compared to experimental studies, we cannot always perform experiments. Therefore, they have a role in informing policy, guidelines, and even public health interventions. Despite their limitations, many important preclinical, clinical, and epidemiological studies, as well as studies in other branches of science, for example, global warming studies, which have linked carbon dioxide levels in the atmosphere with temperature rises across the globe, are completely observational or have strong observational components. In the health, life, and social sciences, and in other sciences as well, there has long been a fruitful scholarly tension between observation and experiment. Facts and reasons, actions, explanations, and mechanisms. Some people always tend to exaggerate the role of biases in such studies. Sometimes a strong association may indeed prove causation. Here are a few references which you may want to go through if you're interested to learn more about these studies. And if you want more precise definitions, you can always refer to this dictionary of epidemiology. These are freely available. To understand terms such as confounding, interaction, biases, and other terms such as risk ratios, odds ratios, you may want to view these short videos which try to explain these concepts in clear and concise manner. Thank you.